Good morning. It's great to be here. My name is Rox Suarez, pronoun she, they. I'm with 211 San Diego and CIE in San Diego. And I'm so excited. So excited to be here and be joined with our primary speakers, Artrese and Tanissha, who will be introducing themselves shortly. So welcome to part 2 of our data equity framework, designing equitable and inclusive systems. If you were able to join the last time, welcome back. And if this is your first time, we're glad you're here. So I think we'll move on to so that you can meet our other 2 speakers if you haven't already. Brianna, if we can bring up T and Artrese, thank you so much. All right, so I'll hand it over for Artrese to introduce herself first.
Thank you, Rox. Good morning, everyone. I am excited to be in conversation and dialogue with you. Artrese Morrison, Director of Programs in the Bay Area for Health Leads, and just really looking forward to this next hour of conversation and information. T?
Yes, good morning, everyone. My name is Tanissha Harrell. I am Director of Partner Engagement with 211 CIE San Diego, and looking forward to exploring this conversation with my colleagues, Artrese and Roxanne. Next slide.
Steve, would you mind sharing with us what resonated with the group last time?
Sure, most definitely. Some of the questions that we posed were around like, good morning, around what people found most thoughtful from the last presentation. And so some of the things that really stood out were individuals sharing that they were going to take some of the concepts and the frameworks and things and go back and share with their prospective teams, have conversation with their executive leadership. And then also what's really cool, like individuals were saying like they were evaluating their own biases and things of that nature. So we put together this word cloud with everyone's thoughts and just wanted to share it with everyone. I think it's pretty cool. Next slide. Artrese, would you like to go over our webinar goals?
Absolutely. So this next hour is going to go by really fast, but in this space, we'd like you to really lean into a learning mindset, open up to some information and some thoughts and some reflection that may not have come before you in the past. I want to kind of think about accountability with grace, knowing that we all have to be honest with ourselves, honest with the harms that we've all done in developing the programs in this white supremacist system that we all are conditioned to work within, but also trusting that we're all on our journey. And so being here today is part of that journey. So to allow ourselves some grace as we walk forward. Reflect on where you are in this space, your individual, as well as your institutional power that you represent. And the dynamics that are created within those in those spaces. And then an ability to apply the framework in some instances. We'll give you some examples and some ideas to really be able to think, oh, I know how this works. I know how I can use this. So that's what we hope to accomplish today. T?
Excellent. Speaking of grace in this space, also, it looks like we've already kind of got started, but what we would like for you to do, we see in the chat, we've got, if you can include your name, your organization, and your location. And then we also have a poll question of which of these goals resonate with you the most? And we'll take a few seconds to go ahead and allow everyone to share. We have lean into a learning mindset, accountability plus grace, reflect on individual and institutional power dynamics, and also apply the framework. So if you could just take a few seconds and vote accordingly. How are we doing on those polls, Rox?
It looks, oh, it just disappeared. So we might have just closed it. Here we are.
Here we are. Awesome.
All right.
Do you want to go ahead? Let's see. It looks like we've got, we'll give it a few more minutes, but it looks like 32% are looking to apply the framework, and that's what we're here for. And then we have another 30% that want to reflect on individual institutional power dynamics, and then accountability plus grades, 23%, and then leaning into a learning mindset, 15%.
And I think what that shows is that today there's a little piece for everybody.
Yeah.
So that's promising, and it looks like we're going to finish strong with the piece that resonates the most, is applying that framework. Awesome. Thanks so much, Brianna, for setting that poll up. All right. So if we could move on, I think, T, you were going to share a little bit about that mindset. We just wanted to recap that for those that missed last time.
Yes. Are you able to hear me okay?
Yeah, you sound good.
Okay. Someone said I sounded a little garbled, so I just wanted to make sure. We're having a little technical snafu this morning. Cool beans. All right, so let's lean into this mindset. We kind of spoke about this in our initial first webinar, but want to stress that this is a reflection and a planning tool. It's not a blueprint. And what we mean by that is that this is a framework to help you facilitate, conversation, discussion with key stakeholders, community partners around system design and equity. It's a starting point, but it's a framework that can be used beyond just data systems. And that's something that we're looking forward to exploring. But it's also a way to, start having the conversation, start looking at where there may be potential breakdowns and opportunities to rebuild. Current systems may look different for each stakeholder. So just bearing that in mind. And this is really where, as Artrese was speaking of earlier, an opportunity to apply grace in unlearning and relearning and looking how we can democratize our systems of care to a liberatory model, which we're still envisioning. Next slide. And so here's where I would like my colleagues to come in. As we expressed earlier, in terms of the goal or the aim is a liberatory model, but we're still exploring what that may look like because, ideally a liberating model would have stewardship and ownership. Design would essentially belong to the people that are most impacted. Artrese, what are some of your thoughts on a liberatory model?
With that, you can't, if you're not visualizing something, how can you reach that destination and goal? So I know we don't have the absolute, this is the end result. That's our point. We are developing. This is a work in progress and an evolution. Doesn't mean we can't work towards that space and get towards that goal and reach that goal. It just means we're not there yet. So we just can't copy and paste. We actually have to do some work and some change and some reconditioning of ourselves and our systems to actually get there. But you can't be it if you can't see it. So this is a lot opportunity for us to really, kind of put some intention in what we want to see.
Yes, I thought it was pretty interesting. Rox, I'd love for you to come into space also as it relates to liberatory model, because, this is where, you said something very profound and significant yesterday about it being, we were kind of playing around a little bit with the tension of the word chartered or territory or things like nature. But can you lean in a little bit, because some of the feedback that we got from the last webinar, this is where people are like, well, what does this look like and how do we know?
Yeah, absolutely. And everything that you both have shared, I feel like is right on. And what I want to add is that if we're trying to picture a there or like a what it looks like, it's a little bit beside the point, because it's really about who got us there. When we talk about a liberatory model, we're recognizing that the only way to be truly liberatory is like if the people themselves, who are everyone involved in the system, are helping to design and build it. And so really a main starting point is like looking around the table and seeing who's at your table, who can you bring to the table, what other tables do you need to go to. That's a really key part here. Is it's less about the what and the endpoint, but it's really about the how you got there and who you got there with.
Excellent, thank you. And also, in reviewing the landscape and system design, part of the process, as Rox was speaking, and Artrese as well, is identifying your institutional system type and characteristics. I think it's really important as you begin to identify and have those conversations. It's not to judge, but to identify where you're at, and then reflecting on your individual role within those systems. And then it's.
And if I add to that, just
Sure.
recognizing that like we all have individual power, how we show up in a space, what we advocate for, we all have institutional power as well. And sometimes we're more comfortable and familiar with that than we are with our own, but just wanting to name that there's both that are always at play here.
Yes, I agree. I love that. We have to be mindful of, in my perspective, I'm always mindful of, as an individual, I'm still part of the system. And so doing that reflection and continuous evolution. And is there anything in the chat that we might want to raise up in this space?
We've got a lot of folks introducing themselves. We've got a little bit of feedback. Colleen shared this last part has been very clear and helpful. And just thank you everyone for your good mornings, and feel free to continue putting your thoughts or questions in the chat or using the Q&A, and we'll be keeping an eye on that as we have the conversation.
Awesome. I'm feeling the energy from the chat. I don't know what it is, but it's good energy. So thank you all. I really need it this morning. Next slide. And I will ping it to Artrese.
Thanks, T and Rox. You've heard this, we've talked about this before. So and then when you read the framework, you've seen these designs. So we really wanted to just bring it back to making sure that we're all level setting for those who weren't in the conversation previously, to really think about this framework and as a graph, as a pictograph, as an image. And so really thinking from the system beneficiary, who benefits from the interventions that you are creating and that you're developing, the strategies to address harm. What are your intentions and strategies to reduce harm and create no harm? The impact on the oppressed community. How is the community experiencing what you've done and what you're doing? And is anyone better off? So we really want to be looking at that, as well as the predatory passive, savior design, allied design, equity empowered, and then as we talk about the aspirational liberatory model. And we'll be having a little bit more specifics about those in a little bit. But I really want us to really be mindful that when you think about your programs and you think about your organizations or institutions, you will find that that some of your interventions may straddle more than one category, and that makes absolute sense. Just pay attention to that. Pay attention and be intentional about what you want to change and what you want to sustain and what you need to do that. So thank you. Next slide. And again, when we think about where we are as individuals, we are in this work, and we've asked you to really kind of focus in on yourselves in your homework and the pre-work that we've asked you to kind of review and reflect about your own power and where you fit into your institution. So when you're thinking about the focus on the needs of the community, of the most marginalized, and where your focus is, when you view power, your own power, and how you hold that and how you share that, and then the impact that you have on the community that is in most need. So you as a representative of this organization, but as yourself, bring in your own bias and your own thoughts. Where do you fit in, and how do you wield your power that you have within these systems? Thank you. Next slide.
I'd love to just raise a comment. It's very that fits so well from Michelle Edison. Michelle shared, public health really does struggle with including those that are most affected by the issues that we are charged to correct, in quotes. We often put programs onto communities instead of relinquishing power to the community, i.e. the experts, so that they can create solutions.
No, exactly. No, I think that's an excellent point. you know, because it is, we get into the space of, you know, I can do this. You know, we have all the education and information. We know how to pull all this stuff together, and, you know, we'll do it for them. And then when we wonder why they don't, the folks who it's for or developed for are not engaged, we can't see that connection of, wow, they didn't ask for this. We didn't ask them if this is important, and now they're not engaging. So somehow, like, where's the disconnect? It's a disconnect within the design. It's made that way.
So Artrese and T, we have some things coming through the Q&A, and I want to raise them and then see if you feel like they feel good to address now, or if we should hold them for when we have our Q&A discussion towards the end. But first off, Muriel McLean wrote, how do you engage your community members around their perceptions? We find that getting authentic engagement is extremely difficult, and we find that too, just a footnote. Alexis Waite asked, is this review from the first webinar? Yes, we actually are doing a short recap, and we are just about to get to more of the applied framework now. Artrese and T, are you thinking we should address these, or should we hold them for a little bit later?
I think we should hold them, and to just give everyone an overview, and to get a little bit more grounded in what we've asked of them in terms of their homework, but also just some pictures in their mind that might help some of this information to be absorbed. So when we think about, thank you, Rox, and we, like I said, we will be circling back to the questions that were asked.
Let's make sure we ping that.
Yes, absolutely. So when we think about case examples and reflection, and the reflection questions that we've asked you all to kind of take a moment to review, T and I will share some examples with you. And I know, and the expectation is that you're not to read this slide. We are to go over these examples for you in turn. And then when you get the slide deck at the end of the presentation, you'll have all this access to all of this. So Jennifer, whoever Jennifer is to you in the world, she sends a check to support a local nonprofit during the holidays. That nonprofit, unbeknownst to Jennifer, sells her name and contact information to a third party, a clearinghouse. That third party sells her information to another nonprofit, and Jennifer receives a mailing of support requests from that second nonprofit that she didn't initially engage. So when we think about that, and you know, I as myself have found my name and received mail from folks that I did not engage.
Yes.
So how much influence do you feel you have in the programmatic and service delivery decisions made by your organization? Do you as an individual, are you the one making the decision, making the call? Are you the one who is just having to execute the work and knowing that there's a disconnect? And I will, before I ping it to my colleague, people will say, well, we need that money. We need that opportunity. So the only thing I would add to that is, yes, that's correct. Many organizations are supported by their fundraising dollars and by these processes. The question that begs the question is, what if you ask Jennifer, hey, Jennifer, we want to sell your information. And if you sell your information, we'll be able to make some money to, improve our programming, to support our programming. Are you okay with that? And if Jennifer says no, then she has the choice to say no. But if Jennifer says yes, oh yes, it just increases my dollars by selling my name as well, then at least she is part of that conversation, and not just, or if it's in the fine print that with our social engineering, that we are not going to be able to read it, or we don't read this fine print all the time. So that quite doesn't count if you say, it's on the paper, but it's the smallest font that we can possibly find. So just wanted to bring that as an example of what predatory means. Doesn't mean your whole organization is a praise. However, there could be components of that organization. T?
I love that you raised that up, because I think as individuals are examining and assessing and evaluating, often like the word predatory, doesn't sound well, and doesn't feel good all the time. And you're like, wait a minute, I'm not, So I think, with providing some of these examples, they're not exhaustive. These are just some ways that we thought we could kind of create some vision. And so as I go into passive, Samuel fills out an intake screening form at a meal distribution program. The form is required by a government agency. The form asks for members of Samuel's household and their income, zip code, last 4 digits of Samuel's social security number. The meal program then sends the information to the government, but also keeps the information on file. This sounds really familiar. I think I've experienced this. Looking at passive, take into consideration, and this is also a way, I think, to kind of level set, you know, when we talk about do no harm and things of that nature. So kind of like just level setting what some of these things can look like. And so as you consider this example of passive, the question that we would like you to reflect on is, how do you prioritize the needs, priorities, and desires of the most marginalized over the needs and priorities and desires? And in what cases do you prioritize your own needs?
Yeah, thank you, T.
Thank you.
When we think of savior design, let's take a moment and think about Shay. She goes to the doctor. When he arrives, he's asked to complete a packet of paperwork with no explanation of why he's filling this out. And it includes a questionnaire on a series of experiences as a child. During the visit, his doctor mentions that he has a high ACEs score and is told that he would be referred to a counselor, and no explanation of why. So you're already in a doctor's space. Many times we already have charged and nervous feelings. You know, here's a person of authority telling us, oh, we found something, and now we were going to send you to someone else, without an explanation of what was that information, and do I get to choose, or is this automatic? And without that moment of, here's why we're asking these questions, here is this information that we think will be helpful, and do you want us? Can you ask the question and say, would you like this referral? Would you like this opportunity? And then going yes or no, and allowing Shay to respond. So with that said, how do you respect and honor the existing power of the community and the most marginalized in your work? And respecting and honoring is by allowing people to have their choice to say no without judgment, because we don't know all of the backstory of what's going on with them, that this may not be the right program for him at this particular time, based on what's going on in his home life. However, we don't know these things if we don't ask the question and if we don't give people choice.
Chastity was asked to attend a focus group for a program she uses. The parent-teen organization is developing a new approach and wanted her to share her thoughts and pros and cons. Chastity provides a lot of feedback to what will work for her and what doesn't. The organization thanks her for her input and makes changes that are affordable and at least labor intensive for staff. Ally design. This feels a little bit different. How do you prioritize the needs and desires of the most marginalized over the needs and priorities and desires? In what cases do you prioritize your own needs? And so I'd like to bring Roxanne a little bit into the conversation. What are your thoughts about like this example in ally design? Do we see anything in the chat?
Yeah, sorry. Let me look at the chat. I was just looking at it a second ago. We do have some feedback on the passive.
Okay.
But sorry, I'm like midstream thought here. So I think when you said it feels different, I want to lift that up because it does. And I think one of the key differences is that the input is more than input. It actually has some influence and something changed as a result. So, you know, that moves beyond asking for input to check a box, but actually implementing, you know, what the spoken needs and desires are. I'm gonna just look back to our chat though. So Jessica shared, the passive example really does demonstrate why some individuals are afraid to go and get help. Will the information be shared with the government, especially from undocumented individuals? That is so
real.
true.
Yes, that's very real. Thank you. I wanted to bring in some voices from the chat.
Yeah, we got another voice. there's some feedback on the ally. I think the ally design example is really important to consider for nonprofits that have limited capacity in their staff. How do they approach those important issues and balance capacity and the needs of the community? You know, as T was describing the ally design framework, I was just, what Artrese was describing, you know, a lot of times we, the norm, the norm is to operate in like what's the most efficient and cost beneficial manner. And that's often to like mechanize things and like, okay, let's identify in this case, this person gets this referral, that person gets this referral. This is the most appropriate resource in these circumstances. And when it comes to people, it's not so black and white and mechanical. And as Artrese was talking about, you do need to have that buy-in in order for your interventions to be effective. If it's not done in partnership, then likely you're not going to have the best outcomes anyway. And so I think it's important to, you should, I see the value from a value standpoint, but you can also make a business case for why incorporating the feedback of, your user base or the persons that you're providing services for, to make sure that they have some ownership in that process is actually going to be more beneficial for everyone.
I agree. And I think, I see some of the comments in the chat popping up in terms of like, how do you, if you have capacity issues and things of that nature. I think when it comes to the ally design, one of the things that I've found in my experience, the old adage, and hopefully I'm not speaking out of turn, if you build it, they will come. That is no longer really the case. And so it's like building it together, and then everyone is mutually beneficial. And I think that can also contribute to some of the capacity things, which leads us
I just have to share, like, whatever we're talking about right now must be fire, because all of a sudden the chat is going off and I can't catch up. But we still got other parts, so maybe we should hand it over to Artrese.
Before I jump to Equity Empowered, I want to talk about ally design as well. And so I think the issue is not necessarily you have limited capacity with your staff. The issue is about setting the expectation and being transparent about the process, because you can't it's not okay to bring people into a conversation thinking that they have decision-making rights, thinking that what they will share will then be executed. It's important to say, this is, what we're trying to do. These are our limitations, and this is what we hope to achieve. And as long as you understand, as long as everybody is unclear with that and understanding that, then what you decide to do, and if Chastity decides to be engaged in that process, it takes hours away from her family or her life or her, priorities, then she's fully informed to make that decision and knowing what to expect. So that's what
I think that's also a way to, like, let's just be honest. Sometimes certain organizations or programs, for whatever reason, may have caused harm, or they have a reputation. And so I think looking into these particular type of examples as it relates to ally design and Artrese going into equity, I think that can help turn around some of the reputation. But you have to be sincere about what your limitations are as an organization as well. And I think being honest about you're still working things out. There's some things that you don't know. I think that will also, that's a form of building together, because it recognizes the limitations and on both parts.
Exactly. Thank you, T. And so when we think about Equity Empowered, we have Joe, a program officer for a foundation. As a white male, he is aware of his privilege. While at work and in meetings, he creates space for his BIPOC or female colleagues who traditionally get spoken over to share insights on topics. He also asks all members of the meeting to consider and consult with those who are not in the room when making the decisions. So when we think about that, we're talking about, as we have begun this conversation today, about self-reflection. So it is apparent that Joe has done some self-reflection in terms of his own power, his own presence, and especially when we're thinking about foundation and funding and money and the power that holds just in general across all of our sectors. This is the kind of work toward energy that we need, is this self-reflection and saying, I don't have all the answers. I don't know all the information, and I need to make space that I actually have for others to be engaged in the conversation. So with that said, how do you share power with others? What do you do that is tangibly sharing your power? And in what instances, what stops you from sharing your power? And I know for myself, when I do my own self-reflection about sharing power, at 51 versus when I was, 31, I'm all about somebody else wants to do some work. Okay, I'm sharing my power, no problem. But at the same time, when I think, oh, am I going to have some kind of, will I get in trouble if it's not done right? Is the timing off? Do I not have time for this? Do I just want to get it done and off my checklist? Those are those times when I don't share power. And it's not always a successful decision to make. So we need to be mindful about our own limitations, our own biases, and our own conditioning, and how we want to address that.
I don't know if you all noticed something, but like when I was saying, like, the ally design felt differently. When we talk about power and sharing power, I think it's really important, and Artrese, you usually lift this up, and you probably have, that communities have power as well. Individuals that are marginalized or underinvested, I'm even having tension with some of these, these terminologies that we use, but we all have power. And I know
you like the underestimated term T.
Yes, I do. And so, even in my, thinking of what does liberatory or what is aspirational about that, I would say even being able to have these types of transparent conversation and dialogues that we're having now.
I'd love to.
Go ahead.
Oh, I'm sorry, T.
No.
I'm sorry. I'm all excited. There's a really great point in the chat that I feel like a question's been posed that fits so well into this conversation. So I want to uplift it. Danielle Dean wrote, where does community organization belong? The method that leads to identification of issues important to the community, researching on the issue and who holds decision-making power and how to build power to make the change. It's not quite ally designed, but the equity empowered example doesn't really match either. I feel like that's a great question. It kind of moves us over to this part about the liberatory model.
Yeah.
Artrese or T, any response to Danielle's point here?
Artrese?
Well, I thought you were already starting that around the community. Yeah. So why don't you start, and then I'll fill in after that.
Well, I think if I'm understanding the question, I would say, I think to some extent, I think we should recognize that there's always going to be some tension. And what I mean by that is not from a negative perspective. I think, community organizing, civic engagement, and I'm going to say sharing or going into existing spaces where that is already happening, but it may not look the way that our funders look. I think that's where respecting that and lifting that up and creating opportunity for that is really important. That's my early thoughts, but I think I'm gonna have to chew on that a little bit more. But initially, that's what first bubbles up to me is part of that power dynamic.
And I wanna also be mindful that community organization is really challenging.
Yeah.
Because community is not a monolith. It's not just one thing focused on one priority.
Yeah.
The community is us. We have all these different needs and wants and cares and struggles and challenges. And it's important to support community who's focused on their particular topic, because that's what we do. We all focus on, like, whether it's, poverty or homelessness or, food insecurity or the environment. We all have something that is drawing us as individuals, and there's a community around that. And so what we're saying, and what I think that is needed, is that we recognize that community in itself has power. It doesn't mean it's over another community of need. It just means it's working parallel with that community. And the more we recognize how to get to that community voice driving it, recognize the same. We may not be talking about the same topic and the same need in our community, but you supporting the food insecurity and me supporting the environment, at the end of the day, that's both going to help. That's going to benefit all of us and some other third group that we're not even talking about today.
Yeah.
So what we're trying to do is, you can only eat the elephant one bite at a time. I think we get so worked up and worried about how are we going to solve all the community's ills, and we're not. That's not possible. It's impossible. So we start a little bit at a time.
Yes, and I think it's important in terms of like when you're centering community, recognizing abundance in community and not just like from limitation and scarcity, even like how we come into the community sometimes or are a part of the community. Like community, there has to be some shared vision. And if you think of like my former colleague, Richard Sacco, we were having a conversation and he said, let's look at a mixed salad, right? Everyone is able to bring in their different flavors and their different ingredients. And so that's kind of like how I look at community. There are, even within community, there are some shared unities, some shared desires and shared goals. But even within those shared desires and goals, I may be on the opposite side of you on some of the issues. And so I think it's really important, like you're saying, in terms of like aspirational, there's a little bit in there for everyone and not looking at it from a scarcity mindset. Because often what you may view as limitations in abundance is someone's norm and they make it do what it do. And so I just think like capacity and things of that nature, people who are impoverished or what we consider, in certain circumstances, they have richness that we may not possess. And so I think identifying those things and lifting those things up is part of a liberatory model, in my opinion. How are we doing for time?
I think we can go to next slide and discussion.
Okay. Oh. So Rox, what's in the chat room, in the chat? I feel like I'm on Clubhouse or something.
Oh my God, there's so much good stuff. It's hard to keep up. And as I'm looking through it, I feel like there's definitely a dialogue happening in parallel. Like the chat is in response to what we're talking about. There's conversation amongst our attendees, which is always wonderful to see. So let me see.
Can I ask a question? Because, one of those things that was really important in terms of, the applied action, in terms of being able to kind of walk people through the individual questions to be able to kind of look at some action. And so I just kind of want to know, like, are folks thinking that, were the examples helpful? We tried to be as diplomatic and as, paint the picture as much as possible. So did that seem to help? Got to give the people.
So we did have some feedback on that. Anna Templeton a few minutes ago wrote, I so appreciate these examples in relation to the previous session's discussion of informed consent and how consent looks different within levels of this framework. Something we really struggle with, secondary data use without very clear individual consent.
Can I just lift something up? I want to kind of like, I see, especially like in healthcare, I saw a comment that said, usually, we identify the program and then we go to the community versus the community coming to us. I think we're like in a really, we're in a pivot with that and how we do that, because I think more and more people are educated and aware that they hold power or they hold decision making. And so I think you're going to start seeing a shift in those types of things, that even though, the hospitals or the funders may have the money to do it, but, it's like your return of investment, it may not, reach its full potential if it's not changed around it and getting that community buy-in and asking the communities what they want first.
Yeah, I think that's right. And within this time frame between these seminars, I had the opportunity to speak with a colleague who was curious about just kind of exploring more about the framework and in context to a program they wanted to develop, or they're in the middle of developing, that really was about taking information that they have learned from their processes and forwarding it to community-based organizations that really will help it would strengthen the services. They believe it will strengthen the services of that organization to that client patient. And because they really see that they're really at need because they have this information. You know, my response at first was really the same. It was, this is a savior model. You know, you haven't asked anybody about this information. You are making the assumption that you're going to, you know, help this person out by giving their confidential information that they are legally available to share with this third party, and so that they can really get the services. And I said, why does it take to really know that this person is in such dire need before the services are available to them? Like, if the services are supposed to be available in general, we shouldn't need this extra layer of need that we didn't give permission to share. So that's part of the structure, right? That's part of the what we are living in. It's like, if you really show me you're in need, then we really can get you some help, as opposed to, we're here to help. You know, what do you need, and how can we do it together? Yes. And what does it look like? So it's just a very interesting thing. And this person may or may not be on the call today. But I appreciated that conversation, because it allowed me, as I'm navigating this information like the rest of you, you know, it's not like, you know, we've been living large with all this information and developing programs with the Liberatory Model. Like, that's not true. We are on our journeys as well.
Yes.
You know,
yes.
Making, you know, and so this is not a report card. This is truly where we are, a current status check. Yes. Because, as I keep saying, I've said to all of my colleagues recently, we can't go to New Jersey if we don't know we're in California. So how do we get there? If we don't know we're in California, we can't get to Jersey. So some people might ask, why would you leave California to go to Jersey? That's not the point. So it really is about all of us, you know, just being honest and reflecting and saying, okay, this is where I am. This is where I want to be. I'll do one more point and then we'll go back to questions. As I was doing this process with someone who runs the HR department for a nonprofit, there's a question that you might have seen when you looked at the reflection tool about what is your desire to rate your desire to get to an equity empowered. And that rating scale is up to you. And so this person did a 1 to 5 rating scale. And they were like, 5, really? We want to do 5. And so we talked about all the steps that we need to think about to make that happen. And then, what is your desire to get to a liberatory model? And that seemed such a daunting task that they said, I think a 3. And then they felt bad about saying 3. And I was like, don't feel bad about a 3. I think that's realistic. It is a lot of work, and it's a lot of change, and it's a lot, and you have to know how you feel and how your colleagues feel, and multiple stakeholders involved in this conversation. So this is not a judgment. It's about just being real, and just, so, you know, and when you are able to say things that are out loud, like all that pile of work that you had on your desk, when you say, oh, I have this, this, and this, you start to realize, oh, it's not as challenging as I thought. It's not as difficult as I thought. Okay, I can do this part and this part. And then before you know it, that 3 becomes a 3.5. So I just wanted to share that before.
I love that. I love that. You know, we didn't get here overnight, so to speak. You know, I think in me doing the individual assessment, and I think these questions make me more present. And what I mean by that is that it makes me more aware of opportunities. Like, maybe I could have shared more power. Maybe I came in with a scarcity mindset rather than an abundance mindset. Is my voice, you know, trying to practice one breath, not taking up too much space in the room. I think sometimes we think that it has to be momentous and quick and fast. But I think, you know, a lot of this stuff has been internalized. It's been taught in our education systems, you know, so we have to give ourselves some grace when we start identifying some things. And I would say, you know, there should be, it's probably not going to be very, how do I say, well accepted. But I think a true assessment, I found myself in a little bit of all 4 of the quadrants.
Oh, yes. Yes, that's exactly right. Like,
in different aspects. I just want to be real, because I think
yes,
we start out trying to make sure we don't look like this, but it doesn't give us the opportunity to kind of say, you know what, I could have, you know, spent a little bit more time with the community. And I think sometimes the challenge becomes, what I hear often is we don't have enough time, but yet and still we've had years of putting systems and things in place and reinforcing those systems support each other, that sometimes we're not patient enough with the community or the people that we're trying to serve.
exactly. So Roxanne, a bunch of questions I see that are popping up, and I am, you know, less adept to look at questions while I'm in, you know, engaged in conversation.
Gotcha. Okay. There's a lot of activity. I just want to uplift that there was, when we were asking, are these examples helpful? It was like a slurry of yes. So that's great to hear from the audience. Let's see here. Josh Greenitz has been pretty active here and asked overall questions. Are there plans to formally advise, consult, coach organizations in this process? Are there plans to create a guide that promotes and shares these ideas?
That is a great question. And I don't know if necessarily Tia or myself can answer without, you know, talking to the people who hold the power in our organizations. You know, I think there's some, you know, there's a real desire. So let's be clear, there's a real desire to be in conversation and to have this be a living and evolving process and information. And I know that even in all of my work and projects, I will be navigating this work through them. In the grander scheme, we'll need to consult and get back to you all of that.
Would love to. I concur with everything Artrese said. I think that shared learning, that collaboration, that coalition building is always very helpful.
So there was an additional question from Josh, and I'm just going to say crew because there's been a lot of dialogue in this chat. But Josh raised a really great point around, you know, how, you know, what do we do when we feel that we've caused harm? And T, I know this is a topic that you love. And then from Yuri responded, well, the first step is naming it. And then Josh replied with a specific case. Let me find it back in the chat here, which, by the way, Josh, really appreciate, you know, your transparency here and you kind of lifting up these hard to deal with questions and realities sometimes. So let me see if, wow, there's just so much to scroll through.
So while Rox is looking at that, I just wanted to, you know, mention around harm, you know, being in my career as long as I've done, I know I've created harm. I know that the programs that I've led and been responsible and held power, there have been clients who left ashamed, left saddened, left without service, left feeling, you know, feeling upset and angry. And either a process that I was enforcing or a situation that I engaged in is part of that harm that was created. And so if people leave your organization without its intended service, that's harm. That's harm that's been done.
Yeah.
I was able to find the specific, oh, sorry.
Go ahead. Yeah, go ahead.
Oh, I wanted to bring, because it's a really specific case, so I think it's helpful to just make it tangible. So 2 examples I encountered recently, this comes from Josh, an emergency food service program who had their list used for identifying undocumented in the mid-aughts, 2000-ish, and now are working to provide services in an undocumented, but that justified grievance is still out there. Similarly, a university program that is embedded in the community, but part of an institution that has historically contributed to gentrification and displacing the community. In both instances, these programs have learned from their error of their ways, but demonstrating that has been challenging. Any thoughts or reflection on that?
You know, I've been in situations like that. I've also been the individual that experienced that. I would say, you know, this is where sometimes that risk comes in. And what I mean by risk is that, as Artrese was speaking about earlier, you know, if, you know, in my experience, I've had situations where I've had individuals approach me when I'm out, you know, just in my everyday life, and said, Miss Tanissha, you lied to me. You said A, B, C, D, E, F, G, and none of that happened. And I'm with, you know, my child at the time, and, you know, pumping gas, and this person approached me, and I didn't feel like I was in danger or anything like that. And I began to say, I'm sorry. And she said, I don't want your sorry. She said, do better.
Yeah.
And that happened when I was 21 years old, and that always resonates with me. This is where I think power, coalition building, ally building comes in place. Sometimes it's not good enough to say I'm sorry. And it wasn't necessarily something that I intentionally did. I just was repeating what I was told without really thinking about it, and thinking about when those dollars ended, when those dollars were coming to an end, what that impact would be, and how people were planning on us to fulfill what we said we would fulfill. And so I know that may not concretely answer your question, Josh, but I would just say in those cases, in whatever way that you can, and collectively bringing other individuals together, do better. And sometimes it's small and it's incremental.
And that person may never, those people may never forgive you and never trust you. And you can't change that, because that's about their choice and their ability to hold that. And nor are they wrong. You know, it's not our job to choose what harm should just be get over it and what harm should stay with people. It really is everyone's ability to own their own, where they are and how they feel about it. And your betrayal may be just compiled lots of betrayal from everyone else in their life. So so it's a lot of it's not yours to hold, and it's yours to hold. So with that said, you know, let the next person see that that's not who you are and what you're about. Not you, Josh, but what your organization is doing. You know, I think about my 16-year-old son and the repeated times I have to tell him not to do something, and the repeated times he tells me he's sorry, and how I don't think he's sorry. So don't tell me you're sorry. Just do better.
Yeah.
And when he does better, then it will no longer be an issue for me. But the sorry ain't cutting it.
So I don't know if that helps, Josh, but that's what I got. And if you want to talk offline, you can email me. It's difficult. And I would say, this is going to sound really crappy, but there's so much that we don't know that harm will happen. But I think one of the things that we have to focus on is, what do we do when harm happens?
What is our plan around restorative justice? And that's the question that's asked in the reflection tool. You know, what is your actual intentional plan around restorative justice? And have you even talked about that? And have you written something down? So at least gives you a guidepost for when the harm is being done.
So where are we at for time? I think we got about 5 minutes.
Okay. Is there anything in the Q&A? I'm trying to be present. Y'all got me up in here crying.
Yeah, I know. It's like, I don't want this to end.
I just want to share what you all are sharing is really, it looks like it's resonating. You know, we've got a lot of thank yous, a lot of thank you specifically for the vulnerability, T, and sharing your experience. So thank you for that, as always. And I do know, don't go yet, because we have a little poll that we're going to share out as we're closing. But let's see, any final thoughts, Artrese or T, what do you think folks should really, what do you recommend walking away with? And also you can respond better if that's not a helpful question.
No, well, I know, at least for me, I think that taking your time through this, getting a lot of heads and a lot of folks engaged, because you might look through some of this and go, our agency's doing this, this, and that. And then you'll have someone else's perspective that says, oh no, I think we're here, here, and here. And I think the truth is somewhere in that middle, right? So I think more the people involved in this conversation. So socializing this, if this resonates with you, socializing this with the people in your work world, so that, you know, because if you also may feel like, God, where do we start? We have so many programs and initiatives, the organization, you know, bring all those voices together and all those heads together, and that where to start will make its way out of that conversation. But it may not be just with you. You may be lost without some extra voices helping kind of go like, oh yes, let's focus on this area. And like I said, eating the elephant is one bite at a time. So don't think that you have to go and like, oh, by June, we're going to be in the, you know, equity empowered. It's a process.
It is a process. As you all usually do, what you see here is the real deal. Sometimes Artrese will start speaking or Roxanne will start speaking, I start thinking, I just wanted to kind of, because I try and be practical. You know, I think one thing is to maybe look at a program or, you know, something within your organization. I don't know if we're going to cut off. Look at where it is within some of the drivers. And let's say it is Savior. Look at your data and say, where could we potentially make this move the needle a little bit, to become more allied. And then, you know, start small. If I could say it that way, I know sometimes we don't appreciate small, humble things, but just start and keep building and keep building and keep building and keep collaborating and keep partnering, keep learning, keep assessing yourselves as individuals. Because remember, the system is comprised of us. So at some point, we can't say they, them, that, we got to say we. That's what I'm committed to. I can't separate myself from the organization or the programs or the communities I'm a part of. If there's a problem there, I'm a part of the problem. So how can I then help become part of the solution, become more inclusive?
T, this group is in conversation with you. We have Lauren who just shared, we also need to be gentle with ourselves as people working in an unjust system.
Yes.
Some of the harm we create is due to things we don't have power to change in the moment. Us doing that harm, it hurts us too. Oh, that's so well said. And at the same time, as we work for change for our clients, those changes will also support us in being able to do authentic and justice-focused work that requires us to do less harm. I don't know that we could have summarized or closed out better.
Yeah, those are my folks. So thank you for that energy.
Thank you so much, Laren. As you sign off, please do complete that poll. It just helps us know how this was for you. So thank you so much for your time, everyone, for being here. Thank you, Artrese and Tanissha.
Thank you,
such a pleasure to be on here with you.
I wouldn't want to do this for anyone else. Well, yes, I would, but I really appreciate you all. And, you know, if you don't have a crew that you can rock with, you know, find you a crew that can hold you accountable, love on you, cheer you up. You know, we all need that encouragement. So love you all. Be safe. Happy Hanukkah, Kwanzaa, Merry Christmas. Am I forgetting something?
Winter solstice.
Winter solstice, you know, is Ramadan coming soon? Whatever you do, whatever you celebrate, have joy, peace, and we love you all. Here's to 2022.
Stay safe, stay well. Stay safe, stay well.